Hello again, it's Captain Mike Godbout with Council Bluffs Fire Department. Today's topic, we're going to talk about safety and first aid, kind of in an industrial commercial setting. Obviously that's a very broad topic. We're just going to try to keep it broad, keep it simple, but talk about a few things that we're hoping that are going to keep you guys safe, and some information that you can provide for us and things you can do to help us help you. So first thing, obviously, we need to make sure we know what your company policies and procedures are, what you need to do if you encounter an emergency. What's your process of notifying your staff, notifying your supervisors. We need to know what is the process to contact 911. Is it you contacting the supervisor and they call, or do you call from your station or call from a cell phone? But you need to be familiar with that process to initiate getting us en route. So be comfortable with your company policies and procedures. Next thing, real briefly, we'll talk about is if you are the person that's calling 911, what to expect when you're calling 911. I can tell you what our dispatch center does, and most of them across the country are going to be pretty similar. Our dispatch center, you call 911, the first thing they're going to do is ask you what's the address of your emergency. They're going to ask you twice to verify it. Then they're going to ask you what's the nature of your emergency and if you can describe it. If it's simply just a medical emergency, we'll just send an ambulance and one engine company. But if it's something that's going to be an entrapment or something that's involving heavy equipment, then they need to know that, because then we're also going to dispatch a heavy rescue company. So if you can describe what the nature of that emergency is, then we know exactly what equipment to send. And again, if you are the person that's calling 911, make sure you notify your chain of command. Make sure somebody knows that we're coming. So if we get to your facility, they're not caught off guard and they don't know what's going on. Make sure we have somebody there. Depending on the location of where it is, we have someone there that can direct us in. So again, make sure you remember those company policies and procedures. And if you're the one calling 911, make sure you know what to expect. One of the topics we're going to talk about today is some basic first aid for lacerations, if that's something that's kind of a target hazard for your location and your industrial equipment, or lacerations, severe lacerations. We should kind of start with the least invasive. One of the first things we want to do is make sure we put direct pressure. Depending on where that laceration is, you want to make sure you put direct pressure. Try to get it what we call circumferential, get it all the way around the appendage, but apply direct pressure. If you have them available, you can use what we call absorbent pads. They're basically just first aid gauze kits. If you have those available, you could use those ABD pads. If you have gauze, you can also always wrap gauze around it. But keep that direct pressure on wherever the laceration is, and then you want to elevate it. Try to elevate it above the heart. If it's an arm, you can have them sitting down and try to elevate it so that laceration is above the heart. If it's a lower extremity, you can have them lay down, and that's always good anyway, especially when you have heavy bleeding, is to lay them down and elevate that laceration again above the heart. Sometimes you may have it available on your location, lots of places may not, but sometimes you can also put ice on it. If it's a bad enough laceration, you do have some ice available, maybe cold packs, you can put that on there as you're waiting for the ambulance to arrive. From that, then we go to the next more invasive step for heavy bleeding. If it might be arterial, then we're going to go to a tourniquet, and Captain Dan Morris, our EMS director, is going to talk about how we're going to apply that tourniquet and what we're going to do with that tourniquet.
All right, I'm Captain Dan Morris from the Council Bluffs Fire Department. We're going to talk about one of the two most important things that you can learn as a skill to help save somebody's life. There's two things that everybody should really learn as an adult to survive in our modern society. One, how to do simple chest compressions and use an AD, and the second thing is to control bleeding. Now, the program that we're going to do is going to be highlighting a program that's known nationally as Stop the Bleed. We're just going to hit a few highlights and point out that the high points, and I would encourage you that if you would like to get more information, you should go seek out that program, and it's called Stop the Bleed, and you can find it at stopthebleed.org. Now, tourniquets, what we teach about bleeding control is stopping the blood loss. So when we talk about massive bleeding, we're talking about an extremity that is bleeding severely. It could be anything from an industrial accident to a simple cut at home. Anytime we have major bleeding, we want to get that bleeding stopped. Once the blood comes out of the body, we can't put it back in until we get to the hospital. So we want to stop that bleeding as quick as we can. So what we're going to use is we're going to use a commercial tourniquet device. Now at stopthebleed.org they recommend two different kinds. This is a soft T tourniquet. The other one is a CAT tourniquet. Now it's recommended that if you want to have a tourniquet, or if you buy one, that you go directly to the manufacturer. Don't go to eBay and buy something or off of Facebook swap. You need to go to the manufacturer and make sure that it's a quality tourniquet that is produced by a known manufacturer. But a tourniquet has a couple of things. We have a strap that goes on the body. We have something like a stick or a windlass device that can help turn, and then we have a way to lock it down. There's a couple of things that when we're putting a tourniquet on, Mike, can you come and help me out for a second? There's a few places that we want to look at when we put them on. Now, if we're talking about an upper extremity, we always want to go above the injury. So if the injury is down here, we want to go closer to the heart. And it's the same thing with the legs. If we have an injury down here, we want to make sure that we're at least 2 to 3 inches above that injury and not on a joint. So if we have an injury down here, what we like to tell people is just go ahead and put it up here, get that bleeding controlled, and then make sure we get 911 called so they can deal with it. If we're talking about the legs, again, we have our upper leg, we have our knee, and we have our lower leg. So we want to make sure that we're going at high and getting that onto the leg. Now when we put a tourniquet on, it's very painful. It's going to hurt that patient to put it, but remember that we're stopping that bleeding to make sure that that person can survive. When we put the tourniquet on, we're going to put it high and tight. We're going to cinch down our strap, and then we're going to tighten. Now when we tighten, and I'm not going to put this on effect, we're going to see that bleeding stop. We're going to tighten this down until the bleeding stops. One of the things that if you know how to check pulses, you should no longer feel a pulse in that wrist once you tighten it down. Once we tighten it, we're going to lock it off and secure it, and then we can go ahead and that bleeding is controlled. We can move on to looking for other injuries or other possible problems. We never, for any reason, as a bystander, we never release these. Now, your paramedics and your EMTs and your ER staff may loosen it for a certain number of reasons, but they're trained to do so. So if you put a tourniquet on because of major bleeding, leave that in place until a medical professional takes over and removes it for you. Thank you.
Okay, so we've talked about lacerations and applying that tourniquet. Now we're going to move on to our next topic, and we'll talk about some more things that we need to consider in an emergency situation.